Hello, my name is Sulina Powell. I am an LPN to BSN student at Indiana State University. This presentation will be discussing advanced care planning, and it is for my community health nursing class. While advanced care planning can be very involved, this video will address certain aspects of care planning so that you will be able to distinguish the differences amongst them. The learning objectives will consist of understanding the differences in advanced care planning, what is an advance directive, what is a living will, what is a durable power of attorney, what is a healthcare surrogate, what is a DNR, and although not used often, it is important to know what is a POLST and/or a MOLST. But first, let's take a quick break. Please hit pause on the video, and in the descriptions, there's a link for a pretest. Click on that, take your test, and come back to the video. Personally, I believe everyone should have an advance directive in place. An advance directive is a legal document that basically lays out what medical decisions you have decided on prior to an event happening. It's not limited to terminal illness, as it may also include medical events such as dementia, stroke, coma, and others. This is a good thing to have, especially if you prefer a loved one to not have to make hard decisions on your care on your behalf. This document can actually help your loved ones make those hard decisions because you have already written out what your wishes are. It also, of course, helps guide the healthcare team on establishing the appropriate plan of care. There are many kinds of advance directives, like living will, power of attorney, do not resuscitate orders, amongst others. It is used for medical decisions only, and the laws are slightly different from state to state. So this would be a good thing to discuss with a healthcare professional who is well-versed in advance directives or a medical lawyer. These decisions should be made while the person is still healthy and capable of making decisions. And while this is something that can't be forced upon you to have, it is highly encouraged that one is put in place. A living will is a type of advance directive. A living will is put in place while the person is still able to make sound decisions. It basically outlines what the healthcare wishes at end of life are, or if someone becomes terminally ill and can no longer make decisions. It directs the medical professionals on what you want and what you don't want done if you are unconscious. This can include how long you want your life prolonged, decisions on pain management, organ donation, and can even include religious preferences. A living will help avoid unnecessary treatments and also reduces the burden placed on families to have to make decisions on one's life. Usually, a living will is encouraged to have when someone gets diagnosed with a terminal illness. When assigning a power of attorney, you have to make sure that it is a durable power of attorney. Well, just having a power of attorney allows someone else to carry out specific transactions and allows this person to take actions on your behalf. A power of attorney cannot make actions on your behalf if you are incapacitated. What is needed is a durable power of attorney. This allows for the legal document to stay valid even if you become incapacitated. Another thing that needs to be specified when obtaining a durable power of attorney is the kinds of decisions that the POA is able to make. You can allow a POA to make medical decisions, or you can assign a separate healthcare surrogate to make medical decisions while the POA can handle everything else. One thing to keep in mind, though, is that the POA loses their power once a patient passes away. The only real difference between a durable power of attorney and a healthcare surrogate is that a healthcare surrogate can only make medical decisions and nothing else. Now, you can assign a POA to make only financial decisions and then list a separate healthcare surrogate in your living will. But for either one, it is important that who you designate knows what your wishes are and will always act in your best interest. A do not resuscitate order, simply known as a DNR, is an order written by the doctor that instructs other healthcare professionals to not initiate CPR if a patient's heart stops and/or if patient stops breathing. This needs to be signed by the patient or the POA or healthcare surrogate and the doctor, and is identified in the patient's chart printed on yellow paper. This is usually set up by the patient and the doctor prior to an emergency happening. It is specific to resuscitation and does not include any other forms of treatments, pain management, nutrition, or other forms of medical management. POLST, which is the physician orders for life-sustaining treatment, is the same as MOLST, which is the medical orders for life-sustaining treatment. The name is just different depending on which state you reside. Florida has been in discussion about fully implementing this form, as it could be used in conjunction with a patient's advance directive, and it is very clear and to the point. Some hospitals in Florida have already started using this form, such as University of Miami Health System and the Jackson Health System. This form comes in handy mostly for the terminally ill or frail older patient, and goes beyond just asking if someone wants CPR. It also includes what other levels of medical interventions a patient might want, such as do they want to be on a ventilator, would they want to be transferred to a higher level hospital, do they want artificial nutrition, and just goes more into detail. It's usually seen in a patient's chart in a pink paper. Personally, I think this form should be used in all long-term care and hospital settings, of course, depending on the patient's health status. I hope this presentation brought some clarity to advanced care planning, and that despite your current health status, that you will implement some sort of plan for yourself in order to assure that your wishes are met. This concludes my presentation. Here is a list of references that were used in my presentation. Please take some time now to complete the post test. You can find a link in the bottom in the description section of this video. Thank you and have a blessed day.